Hi everybody. I had a few brief questions. I'll answer them quickly and then you can enjoy your weekend. They're all about coronavirus, no surprise. Let's start with the terminology just so we're straight with that. So the name of the bug is called SARS, S-A-R-S, Severe Acute Respiratory Syndrome, CoV-2, coronavirus 2, because there was a similar outbreak and a similar organism in 2002 to 2003. That was the first SARS outbreak. So this is the second one, so that's why it's called a SARS-CoV-2 bug. And this bug is a coronavirus, but it's not all coronaviruses. It's like the animal kingdom. You have animals. Within the animal kingdom, you have mammals, and a lion is a mammal. And a lion is aggressive and mean. And it's like the family of viruses. Within the family of viruses, there's a family called the coronaviruses. And then one of those types of coronaviruses is mean and aggressive, and that's called the SARS-CoV-2. Anyone can get this and not have any symptoms. Anyone can get this and have a runny nose or a cough. When the illness progresses to its severity, it's called COVID-19, coronavirus disease 2019, because that's when it started this year in December 2019. And that disease, that severity of that disease is generally a fever and a cough and shortness of breath that progresses to pneumonia and hospitalization and even death in some cases. So the transmission we've talked about in the past can be hand to hand. So in other words, somebody sneezes on their hand or coughs on their hand and then touches your hand, and then you have it on your hand and you infect yourself. Another way is that you're within 6 feet of someone and they sneeze, achoo, or they cough, and then they spray it on you or on your hands and then you touch yourself. What may be even more the common spread, more commonly spread is by inanimate objects. People are thinking right now, the scientists, that there's contacts of your hands on an infected counter or an infected doorknob, or like going to a buffet, when you have hundreds of people touching the same spoon, that spoon is contaminated because they're finding that this organism or this bug can stay alive on that surface for hours to days. So that's a working hypothesis on how this can be spread. So we're still left with the same question of treatment, and there is no treatment. We're still left with the same thing as how do you prevent this, and it's the same way that you prevent any disease, especially now in the winter, and that's with hand washing and staying away from sick people, and now even using a disinfectant spray or a wipe on counters or doorknobs or buttons that you're touching. Sometimes your best friends are the hand sanitizer or the disinfectant wipes. So you're left with the same answer after all this anyway. Instead of living in fear of getting it, just work toward preventing having any contact with any infectious objects or people. So this last question that I got is more controversial, but I'll still try and answer it. So the question is, should I still receive communion, or will my not getting it decrease my chances of getting an infection, even from the coronavirus? So I don't think it's anyone's right to tell you how to practice your religion or what to do with your religion. So I can't answer that part of the question. I can answer your second part of the question, though, in that if you share an eating utensil or a drinking cup or a napkin with one person, you're probably increasing the chances of an infection from that person being transferred to you. If you're sharing a spoon or a cup with tens or hundreds of people, you're increasing your chances 10 to 100 times. So I don't know. I think I kind of answered your question. That's about it. Try and see you next week. Have a good weekend. Bye-bye.